So with that said, and this goes back to some of what Melissa talked about at the top, what do healthcare consumers want? Increasingly, we have conversations with clients around they want, no pun intended on our own name, but they want clarity. There is a very, very complex world of healthcare that, as a system, they're trying to understand. And from a very personal level, they're trying to work through. And so, if you can meet them with the message that is convenient and that it is easy to use and not mired in complexity or whatever some of those complexities might be. And if it's increasingly feels like you know who I am and you're providing something relevant to me. So when we kind of mix that, you've got a few minutes when you send out that ID card, that EOB, whatever that is. Are you then populating that space and that time with your member and they're being forefront with your brand to introduce these types of content in front of them and these types of actions in front of them? That's really the difference that we've seen in terms of engagement versus crumple it up and toss it. And of course, that has kind of a lasting effect. The more trust you build, the better you're going to get that resonance there.
Yeah, and that 75% of healthcare consumers looking for personalization is spot on, right? When you go to the coffee shop today, and there's 20,000 different options for how your coffee can be prepared at Starbucks, for example, you have those options. It's super personalized to you, and then it pops back up on the app, and it's easy to go ahead and select it next time. And so consumers obviously are looking for that everywhere now, and healthcare has just been slow to catch up with that.
Absolutely. I also think, there can be kind of a tail chase around the word personalization, and it gets emphasized at such an intense degree. And I think where healthcare is starting from, and we're looking at just some generic examples that I'll say is certainly not the entirety of the industry in plans distributing correspondence out to members. But I think it's fair to say that we've generally looked at this, at least historically, as we need to get you this message. And so that sentence started with we need you. And that's a sort of a fundamental premise of if we land this in your lap, then kind of job done. And I don't think the point is to really indict that as much as it's to say the bar is really easy to start having a brand improvement experience. Because if this is sort of our starting point, some of the tactics that Melissa referred to and some of the ones we'll show examples of, they're very approachable and they don't need to involve sort of doing an administrative overhaul. They don't need to involve having, a huge all hands to say, how do we want to change this? We can make these tweaks that are really comfortable for us as a brand and as a health plan, but they have a dramatically different interpretation from the member's perspective. So if we just look at an example of that, this is kind of the exercise that we go through with clients. We'll say, show us what you're doing today. And what we want to do is then come back and say, there are tactics that are native to consumer marketing, that are native to behavioral science, that we feel like we can introduce without fundamentally changing any of the messaging. So you saw something like this in a more generic form from Melissa, but we went through this process and said, let's add some of these tactics. We know that buried somewhere in this letter at the left is a call to action. And if we think about fundamentally a call to action, it's just an invitation to a member to say, we think there's something you'd really benefit from. Let's try to get you involved in it, because then you're starting to gain value from those benefits that you're paying for. So what we do is really just bolster some of those things through the use of these tactics like QR codes, through this Johnson box up at the top right in yellow, which is going to elevate an opportunity from the balance of the content. And then through tactics like highlighting things at the below of that one unchecked box that we're going to then make it really convenient for you to complete. So a lot of different elements in here. And what I love about the overlay of these comments on the right and left side of this is, to a member, it just looks like an 8.5 by 11 piece of paper. But when we're running all of these different tactics and plays, sort of the underpinnings of how we put it together, the yield is so different. And so the interesting part of this, and what I'd really challenge all of you with your partners to ask the question, is this a graphic design exercise, or is this really an ROI driving asset that we're creating here? So we encourage our plans, as we'll see on the next slide, to start making sure that you're actually measuring on this. And it's not then we believe that one letter is more engaged with than another. It's actually looking at this and starting to track things like, was this QR code clicked? By whom was this QR code clicked? More from our Medicare line of business or our commercial line of business? More from males or females, zip code differences, etc. But you really start to get a sense of where are we valuable in our communication versus where are we sort of noisy. In this case, we sent this out just for a period of a few months to a little under 100,000 households, and we saw 7,500 members register for the portal, which was the requested action here. That health plan shared with us, look, we, from an actuarial standpoint, ascribe about $9 worth of value to anyone that we build that digital connectivity with. And so we were able to take something that used to be just a put stamps on it and send it out to members and turn that into an ROI case of we just took a few months and a little bit of design risk, and we created $67,000 worth of value. This is a small vignette of an example, but it just shows that we really didn't have to do anything different. We didn't have to implement a new vendor. We could just set up some really basic testing, and all of a sudden we fundamentally changed the relationship with something that we know is going to be distributed out to members in high volume every year. If we go on to the next one, this is, again, just a quick case study where we were focused on mail order pharmacy with a regional health plan in this case. And we, again, introduced some tactics that were not fundamentally different in terms of changing the content that we were presenting to the member, but just changing the form factor. One additional add-on that I'll say with this is, boy, have we all been conditioned by the financial industry to respond to a sticker that comes on top of a card. And it's been a really nice opportunity, and we'll show some examples of this later, of almost the easy button for if you want to increase lift on an action you're requesting, get that sticker on there with a really clear call to action. And we have overwhelmingly seen that you get a little more bump from those people. So when we put that marketing hat on and we say, well, what's the difference if, out of hundreds of thousands of people, we get a few hundred or a couple thousand more to register for something? That becomes a really great question around deciding what your strategic calls to action are. This particular health plan had a big push towards a new mail order pharmacy program that was implemented because they were seeing increased gaps in med adherence in their star ratings. And so I think, like a lot of health plans, it was, are we being bold enough with retail options, with mail order pharmacy options, especially in a geographically dispersed membership like we have? What we saw in running this over 4 months is that within about 30 days of receiving this content, 11,000 people at that health plan took the action and signed up for that portal register, for that mail order pharmacy program. Now, in this case, the big thing you'll see different is that this is such a high value action because we know it's directly correlated with closing a care gap, that it is at a unit value. This one is much, much more appealing to that actuarial team. And saying the ROI case on a mail order pharmacy program is more like a few $100 per member that gets involved because we know we're going to see it in the star ratings. So again, I mean, the numbers start to become really compelling to say we didn't have to buy anything new. We didn't have to implement anything differently. We just took a fundamentally different approach to our member correspondence, and were able to create a huge amount of outsized value. And in this particular instance, they said we ascribed that up in the millions in terms of that $350 times 11,000 people. So we're all, as organizations, you're being asked to do more with less. I guarantee it. That's what I hear from every plan that we talk to. And it's a ripe opportunity to say, we've got to get more out of everything that we're putting out to a member. And this is just, again, that vignette of what you can do on that primary correspondence side.
And, I'll just add, Drew, because this is such a great example, how important it is to test things and learn and figure out what is going to work. So The sticker is such a good example of testing, and often folks don't or are hesitant to test because it
Yeah.
means keeping a control group. And when you're keeping a control group, you may feel like, oh, but I should be using these funds in a different way. I should be making sure that this iteration or this intervention is being deployed across the entire population. And I totally understand that perspective, but when you don't have the control to test, it makes it incredibly difficult to know what works in terms of optimization. So we always are very mindful of that. I know you all are at Clarity as well, and trying to really drive the opportunity to test and learn.